So now the question is, after 2 cesarean, the third pregnancy, the next birth, which is going to be a cesarean, is it a must to tie the tube? Why doctors ask you to tie the tube? Is it really a must? You see, in cesarean, we are going to ask you to tie your tube because we won't allow you to have too many children. Why? Because with each cesarean birth, your risks increase. What are the risks that we are talking about? Number one, everybody knows about scar rupture. Yes, the risk of scar rupture increases with each cesarean. And we know when you have scar rupture, there is a possibility that your baby may become a mentally retarded child. Because when scar rupture, usually there will be damage to the baby's brain. So is that something you are willing to accept? Because we know that with every Caesar, the percentage of scar rupture doubles. That is number one, but that's not the most important thing. There are other problems. We worry about caesarean scar pregnancy. Caesarean scar pregnancy is a pregnancy that happens at the caesarean scar. And this is a kind of a pregnancy that you cannot keep. If you know early in your pregnancy, in an ultrasound scan, doctor scan, and say, hey, madam, you have a caesarean scar pregnancy, that's fine, because then I will just tell you, you have to abort your baby. You have to abort your baby is because if we allow the baby to grow bigger, your life will be in danger. But unfortunately, not every woman go and see gynae at the very, very early stages of pregnancy. So if you miss this diagnosis of caesarean scar pregnancy, then the next problem is this baby that is going to grow in your caesarean scar will have high risk of either number one, the scar rupture early, maybe rupture at 3 months, 4 months pregnant. You don't just lose a baby, you will almost lose your life, and almost 100% the doctor is going to remove your uterus. What if caesarean scar pregnancy is not too bad and it continues to let your pregnancy go on? Then what you'll see is your placenta. Your placenta will be implanted at the caesarean scar. And when the placenta implant at the caesarean scar, this is what we call placenta accreta, percreta, increta. There's so many names to it. It all depends on how deeply implanted is the placenta on your scar. And what does it mean? What is placenta accreta? So what? Placenta accreta, when you have it, number one, high chance you're going to bleed like mad when you give birth, which means that ICU care, blood transfusion, and most likely you will lose your uterus. If you can reach up to 9 months, baby usually fine, not too much of a problem, but you will most likely lose your uterus, ICU care, blood transfusion, and you may not survive. And because of that, we all worry about all these risks. So when women ask me, is it a must to have a tubal ligation? Is it a must to have a BTL? My answer would be very simple. I will explain to them all these risks. So this risk comes about life-threatening risk. You may die if you keep on getting pregnant again and again, or your baby may die. So if you don't want a tubal ligation, it's very simple. Number one, can you be 101% sure, really 101% sure, you will not get pregnant after this? That is the tricky part. Because even though no matter how you think that you can prevent pregnancy, there is no contraception in this world that is 101% safe. And the next question you need to ask yourself, because we know nothing is that safe, there's no contraception that is even 100% safe. So let's say if you get pregnant again, are you willing to lose your baby? Are you willing to abort your baby? Are you willing to lose your uterus? Because the few things you need to understand, you may need to abort your baby, a live baby, you have to abort. Not all women will abort their baby. Religious reason, attachment reasons. Not many women are willing to abort their baby. I have seen so many women that when we counsel them to abort, they just keep holding on and holding on and holding on, and they just can't do it. The whole family, the husband, the relatives, they can think that that is the best choice for you, please abort the baby. But not many women can actually walk that path, knowing that the baby is well. Second, are you willing to lose your uterus? Because if you're going to have a caesarean scar pregnancy, placenta accreta, placenta percreta, if you carry on with the pregnancy, or you didn't know you have this complication until it was too late, you're most likely going to lose your uterus. Are you willing to lose your uterus and live the rest of your life without a uterus? And last, are you willing to risk your life in the ICU knowing that you're dead? You may survive and you may not survive with your first 2 other children who are still young at home just because you decided not to do a tubal ligation. This is again a thing that I always face. Most women at the point of life and death, the only thing they worry are the other children at home. So the fact that you have 3 or 4 pregnancies already, you will have 3 or 4 children at home that need a mother, and why you want to risk your life for them. So as far as my patients are concerned, my mothers are concerned, I don't always put it as a must. I tell it to them and let them make their decision.